Hey guys, so let's welcome Dr. Deepika. Hello, Dr. Deepika.
Hi, Pranjal. How are you?
I'm good. How are you?
I'm good, thank you.
Great. So let me introduce, guys. As I was mentioning, Dr. Deepika is an orthodontist, and she is a part of Clove Dental in Pune. And today we are actually going to talk to her about aligners because a lot of us have heard about aligners, but we are not sure about it, what exactly it is. So we are going to ask Gitika all our queries. So let me start with some of the queries which I have, and then obviously we can take the questions from the viewers as well. Okay, doctor, should we start?
Yeah, sure. Please.
Okay. So the first thing, let's explain everyone what is teeth straightening and why is it important?
So, we have a specialty called orthodontics in dentistry. So, this specialty deals with straightening of the teeth. So, when the teeth are malaligned or they are crooked, it will further lead into periodontal problems or cavities and gum issues. So, to prevent all that, it's important that the teeth are in their right positions according to the jaws.
Okay.
So, that's the reason we suggest orthodontic treatment along with function and aesthetics.
Okay. So the main second thing is teeth straightening a specialized treatment? And why do we need a specialist in that? Can't we just, get something like aligners and fix it by our own?
So braces and aligners are a long and expensive process. So the treatment duration may vary from 10 months to 20 months. So
Okay,
depending on the severity of malocclusion, it varies from 10 months or 7 months, or it may go up to 20 months. So the orthodontist evaluates the 3D images, the X-rays carefully, and will develop a customized plan according to the malocclusion you have. So post treatment also we develop a treatment plan so that the teeth are retained in their corrected positions. So
okay,
and the orthodontist goes through a special training program for 3 years, examining different types of malocclusions and examining different types of orthodontic cases after their
okay.
dental graduation. Yeah.
Okay. So I think one question everyone might be having that what is the difference between a dentist and an orthodontist? And what is the difference? Can you just differentiate? Because a lot of people think this dentist is what it is. Then what's the job of orthodontist?
See, so all dentists are not orthodontists, but all orthodontists are dentists because
Okay.
after the basic graduation, every who chooses the specialty orthodontics, they go through a specialist training for a duration of 3 years. So
Okay.
where they study different types of malocclusions, different types of overbites and irregularities, overlappings, and how to customize the treatment for each patient. So, which will help in designing a customized plan. So, this is how an orthodontist varies from a dentist.
Okay. Sounds good. And I think now I my query is answered. Okay. So now, what are the different options for teeth straightening that we have?
Varieties of options. Previously, there were a lot of teenagers who used to get the treatment done, but right now we have extended the orthodontic treatment options to adults also. So we
Okay.
have braces. In braces, we have metal, ceramic, and lingual. So in braces, we have metal braces. Those are the conventional and traditional braces. They are
Okay.
economical, but they have a visibility. That is, aesthetically, they are visible when the
Okay.
patient wears the braces. Next is we
Yeah.
have ceramic braces, which are less visible but they are a little pricier compared to the metal braces. And next we have lingual braces, which are also completely invisible, but they are placed inside the teeth, not outside, not on the teeth, on the back side of the teeth. So,
Okay.
but they have a disadvantage of a lisp for some time until the patient gets used to it, and some difficulty in their tongue. So coming to braces, these are the three different types we have. And then we have aligners as well, which are completely invisible, removable,
Yes.
and which are customized for every patient.
Okay. But if we compare braces and aligners, like which are more cost effective?
Definitely, braces are more cost effective compared to
Okay.
aligner.
Okay. Okay. Great. Okay, guys, I'm just taking a pause here. Do you have any queries right now, or otherwise we'll just go ahead with our routine questions for you guys? Okay, any queries, guys? Or even if you have queries, you can drop in the comment section and I will take that. Okay, good. Okay, doctor. So we'll head to the next question, which is what is the benefit of getting an aligner treatment done instead of braces?
So, as I told you before, aligners are clear. They're completely invisible. They can be removed, and they are customized for every patient. So,
Okay.
the main advantage of aligners is they are very comfortable, and you don't have any diet restrictions.
Okay.
And when we go with aligner treatment, it's not necessary that the patient has to visit us every month. So we can do a
Okay.
virtual monitoring, and the patient can just keep changing his aligners every 2 weeks or 10 days. And he has to wear it for 20 to 22 hours a day. So we don't have to monitor it. There is no need for him to physically be present at the clinic for
Okay. Okay.
the active treatment to go on. We can monitor it virtually, and the treatment keeps going on as he keeps changing his aligners.
Okay. And one question is asked a lot that how are these priced, like the aligners? How are they priced?
So we have different types of aligners based on the severity of the malocclusion. So if it's a very mild case, we start from around 90,000, and it will go up to if it's a complex case, that if it needs n number of aligners, like say around 80 aligners, 70 aligners, it will go up to 2.9 lakh or 3 lakh. So
Okay.
this is for the entire 15-month or 20-month period, the entire cost. So the price range varies depending on the severity of the malocclusion.
Okay. So we have a question that why the aligners have to be changed after every 10, 15 days, as you were mentioning.
The aligners are made after the orthodontist makes an impression or a 3D image, and we develop a treatment plan, and they give us a set of aligners. So suppose a patient will have to wear around 14 aligners. So a certain amount of force is uh, divided into each aligner. So we can't incorporate we have some optimal measures. We have to incorporate some optimal force. So that amount of force is incorporated in each aligner for the tooth movement to happen. So that's the reason they have to keep changing aligners every 2 weeks, because the force becomes void, it becomes null after their first aligner. Then they have to go to their second, then third, and so on.
Okay. And is it very easy to remove and place the aligners back?
Sorry, yeah, it's very easy. It's just like a tray which can be removed, and we can put them back. They are very
Okay.
comfortable.
Okay. We also have one more question, which is which brand of aligners should we choose? Tootsie, they have written.
Sorry.
So there is someone who's asking which brand of aligners is. Are there different kind of brands and aligners that you should
Yes.
choose from?
Yes, we have different kinds of brands in aligners. So even what you should choose, we suggest you depending on the severity of the malocclusion. That is how severe your problem is.
Okay, okay. Guys, anything else? Otherwise, I'll get to my next question. Okay, I think we'll head, and if there's anything, we'll ask. Okay. So, what kind of aligners do you use, and how long does the treatment take?
See, as I said before, the treatment duration varies depending on
Yeah.
the severity of the malocclusion. So, the treatment duration varies between as less as 6 to 7 months, 10 months, or 20 months. So,
Depends on the requirement of that particular
requirement
patient.
of the of that particular patient. It's customized to every patient. We don't have a standardized timeline.
Okay, okay, okay. And yeah, this is very important. Are braces and aligners treatment painful?
Uh, Pain threshold is a pain is a subjective response, so it depends on multiple factors. It depends on the age of the patient, the pain threshold the patient has, and then it depends on the amount of force we apply for the particular teeth to move. So with both braces and aligners, they can expect some pain and discomfort for the initial 2 to 3 days when we place. After that, that comes down. So again, next time when we activate or when the patient changes the aligner, again the pain stays for 2 or 3 days, and then again it comes down. So pain is a subjective thing, which depends on which varies from patient to patient.
Okay. Is there anything that the braces are less painful or aligners are less painful, anything like that, or it's equally
It's
subjective?
definitely aligners are more comfortable
Okay.
compared to braces, and I would say aligners are less painful compared to braces.
Okay. 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 So here Mayank is asking that why are Indian aligners cheaper?
Uh, Indian align. It's see, we have different companies in aligners. So the companies which we don't have here, they have their manufacturing units abroad. So we have other costs which are added up to the aligners when they send us back here. So that's the
Okay. Okay.
reason the price range varies between Indian aligners and other aligners.
Okay. Okay. What do we have? Okay. And also, they are asking, are they good for basic treatment? I am not really sure what is the definition of basic treatment over here, but yeah.
Aligners, are, yeah, for a they are good. They are good. Now we have different types of aligners, different brands and everything. So from basic treatment to advanced treatment, all types of aligners are good.
Okay. 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 So our next question is, what are the precautions that a patient should take to have a successful teeth straightening treatment with the help of aligners?
One is patient compliance. So coming to aligners, patient compliance is very important because the patient has to wear the aligners for at least 28 to 22 hours a day, and he should note it down in a calendar, or he should remember that he has to change his aligner every 2 weeks. So coming to aligner treatment success rates, the compliance of the patient is very important, and then visiting us whenever possible, once in 2 months or 3 months, and virtually monitoring the treatment progress and the post treatment using the retainers. So this helps in success of the aligner treatment.
Okay. And RJ had a question that what all brands we have for aligners. So I think RJ, I would like to tell you that Clove Dental is one of the best. And the best thing is they have almost 200 clinics around India, in which 13 are located in Pune. Am I right, doctor?
Yes, yes, sir.
So you can simply call on their helpline number and take an appointment and visit an orthodontist for your first consultation. And accordingly, whatever is the requirement for you, that will be suggested by the doctor, and you can take ahead your process. So now, guys, do you have any more queries regarding aligners? Anything related to aligners? Dr. Gitika is here to help us with all our queries. So if you guys have any queries, please write it down in the comment section. Other than that, Doctor, would you like to share anything that we have missed out on aligners, about aligners?
So basically braces and aligners both are a long process. Both take at least 10 to 12 months to complete, and patient compliance and also visiting the orthodontist frequently for checkups and following the treatment, following up how the treatment is going, and proper maintenance of the teeth and gums during their orthodontic treatment will help in finishing the treatments on time and give good results to the patients.
Okay. So, doctor, do we really need to wear it while sleeping also, or we can remove it while sleeping?
No. The optimal aligner time wear is 20 to 22 hours. So it's
Okay.
mandatory that they should be on while sleeping also.
Okay. Okay. And is there any specific kind of brush or paste that is suggested, while during the duration that we are having aligners?
Yes, we suggest you separate, especially during braces treatment, we have separate orthodontic brushes for it, separate interdental brushes, and we suggest a fluoride toothpaste to prevent a cavity formation, and we suggest fluoride mouthwashes. So we have a separate set of products which we give for patients who undergo orthodontic treatment.
Okay. 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 So, doctor, one thing is pretty sure that we use aligners to do the alignment of our teeth.
Right.
Okay. But what if, there are generally this gap between two tooth.
Right.
So, does aligners help to, fill in those gaps also?
Yeah, definitely. Definitely. Such mild cases we can do with aligners, and the treatment duration is very short. We can do it in 4 to 6 months duration also. If it's a orthodontic relapse case, or if it's a very mild spacing between two teeth, so we can close the space, and post that we can give a retention so that the
Oh,
space doesn't open up again.
oh, okay, okay, that sounds good. Okay, we have one more query, which is if someone is having TMJ problem, I'm not sure what TMJ is, but can he go for aligner treatment?
Yes, they can go for aligner treatment.
Doctor, can you explain what is TMJ problem?
TMJ is basically a temporomandibular joint. It helps in opening and closing the mouth. So
Okay,
the joint is there, which usually it helps in opening and closing the mouth. So
okay,
usually those problems arise when there are any premature contacts on the teeth, or
okay.
any night grinding habits. That is, a few people tend to grind their teeth in the night. That is called as
Yeah, right.
druxing. So few people who have such problem also develop temporomandibular joint problems gradually. So aligners
Okay,
help such, yeah. So aligners help such people a lot because they act as a guard during nighttime. That is, both the upper and lower teeth don't come in contact. So they, in a way, indirectly, they help in relieving uh, TNJ problems. And those who have TNJ problems, they can use aligners. It's not that they are contraindicated in them. We can always find out the cause, give a solution, and then we can start aligner treatment.
okay, okay, okay. That is really helpful. Um, okay, so anxiety can also be a reason for that gringing of the teeth, right?
Right, grinding of it. Yeah.
Okay, okay. Great. Okay, guys, do we have any more questions, any more queries for Dr. Gitika? Okay, we don't have. Guys, if you have any queries, do let us know because otherwise we'll be ending this live session pretty soon in a couple of minutes. So, yes. And Dr. Gitika, so are you situated at one particular clinic or you take care of all the 13 units in Pune?
I'll be there in all the 13 clinics in Pune.
Okay, okay.
On a
And if
weekly basis.
yeah, and if someone specially wants to get an appointment with you, then how can they do that?
They can contact the Clove helpline and they can take an appointment on my name. So in whichever clinic I am available on their date, they can take a appointment there.
Oh, okay,
Depending
okay.
on their flexibility. Yeah.
Okay, okay. And which all cities do we have Clove Dental? To name a few.
We have in Pune, Hyderabad, Ahmedabad, Bangalore, Vizag, and then Delhi, Noida. So we have in all major metros.
Metro cities.
Yes.
Okay, okay. That's great. That's how we come up to 200 clinics.
Right.
Okay, guys. So do you have any queries, guys? Because we should not waste time of Dr. Gitika. It was really helpful though, doctor, for coming here and helping us out with all these queries.
Thank you. It was great talking to you.
Yeah, because I talk to a lot of people and they have so many queries regarding aligners because I think that's really trending nowadays. A lot of people are
Yes.
getting it,
Right.
but they are not understanding why is it required, how is it required, is it safe, or how many hours and how many months it takes. Okay. So RJ, we have already answered that query that what is the difference between braces and aligner treatment. So if you have missed out on that, I'm going to save this live on my feed. So you can go and have a look at the entire live once again. Guys, any more questions? This is the last time and otherwise we are going to end this live. Okay, I think Dr. Gitika, there's no more questions because we have, I think, covered pretty much everything.
Okay.
Yeah. So thank you so much. Thank you for all of us, all our viewers, and from me for coming here and giving us, helping us with all our queries actually.
Thank you. It's a pleasure.
Thank you. Same here. So guys, if you want to take an appointment at Clove Dental, you need to call them at their helpline number and take an appointment in your nearest clinic. And if you're looking for Dr. Gitika, you need to mention it to them and they'll give you the appointment for this team. Okay, guys, thank you so much for being there. And if you have any more queries, you can definitely DM on Clove Dental Insta handle also. They'll be happy to help you there. Okay, thank you, Dr. Gitika. We'll take your leave.
Thank you.
Thank you so much. Bye, everyone.